Hello and welcome. My name is Nikki Andrews, and this webinar is going to discuss social media and how to communicate with your internal staff. So let's jump right into it. While social media is a great place to share funny stories and cute pictures of your pets, trust me, I love to share pictures of my dog on social media. It is also a great tool to share medical information and information about your site. During COVID, we saw just how important social media is to share information quickly. While we did have some issues with statements that weren't accurate, most of the information was real, helpful, and kept millions up to date in an ever-changing pandemic. The WHO, along with the University of Melbourne and Polefish, collected data from almost 25,000 respondents from ages 18 to 40 in 24 countries across 5 continents. And what they found was that 44% were most likely to share scientific content and 38% to share information they thought was relevant to others. Social media is a great place to communicate with your patients. You can post about your business hours, operation, vaccines, and other important information for your patients. So let's talk about the different modes of social media. Maybe one of the ones you're more familiar with is Facebook. Facebook is widely used by a lot of people for a lot of reasons. And Facebook is a good tool for sharing information on social media with your clients. It allows for a lot of characters, up to 450 characters for Facebook posts. It allows you to share information about your practice, add pictures, add hyperlinks, and it gives you an opportunity to really connect. Just keep in mind that social media tone is a little bit less professional and more friendly. This is a good place for you to share information about practice hours, changes in practice, additional staff, highlighting staff. Things of that nature are a perfect place to share on Facebook. Next, we're going to discuss Twitter a little bit. Twitter is really nice, and I use Twitter a lot in my personal life because it allows you to hashtag. So you can hashtag COVID-19, and it brings your clients back to all the posts that had a hashtag of COVID-19. You can add another institution, such as the WHO or the CDC, and it's for really quick information that you want to share with your clients. It's really nice because, like I said, again, you can keep your patients up to date on the ever-changing, pandemic. So now we're dealing with Delta, and you can have them at different organizations, different practices, and let them see exactly what other people are writing or people are saying about something. It's also very quick, so keep in mind, Twitter is only 240 characters. You want to keep it to about 200, so a lot of people to repost your posts and to add their own text to your posts. So for example, if I was going to post something from PCDC where I work, I would now say, hey, look at this really quick post from PCDC on the amazing work that they're doing. So you want to try to give the opportunity for your clients to be able to do that when they're sharing your information so that they can add value and add to their community as well. Next, we have something that's not really social media, but something to use a lot, and it's text. A lot of practices have text for their clients. It's a great way to communicate about vaccines and reminder appointments. So people are due for cold, flu, wellness checks, things of that nature, preventative care measures. It's a great place to send out a text to your client. When sending out text, keep in mind you want to give patients the ability to opt out of texting. So if they don't want to receive it, the stop notification is wonderful. But you also want to be very quick identifying who you are early on in the text. So if you're sending the text on one of those robo numbers, which is an anonymous number and not your actual practice number, you want to be very clear and say, hey, this is so-and-so's practice. We are trying to reach you for your wellness visit. Be very clear, concise, and upfront with what you want the person to do. Have a response, have a call to action, so to speak, so that people know that they're going to be clicking on this so they can either make an appointment or call the office to set up an appointment. So communication, we're going to shift gears a little bit, isn't just only about social media, but it's also your internal communication and how you speak to your staff. So keeping your staff, your internal communication is key to keeping your staff up to date And using your newsletter, having a comms point person, setting up a communication plan during and after the pandemic is important. So here are a couple of steps that I think are important for effective communication with your team. So one is create regular communication cadence, meaning you're doing newsletters, you're doing email, you're doing town hall meetings. Allow time to share information and obtain feedback from your staff. So this means if you're sending out a monthly newsletter, keep it consistent. Make sure it's monthly, it's being sent out, that you're taking opportunities to have some space where people can ask questions or they can email someone if they have questions. You want to have open communication with your staff and be transparent. Another thing you want to do is you want to listen to your staff. So once again, have some kind of vehicle where they can leave feedback, where they can ask questions. Knowing their thoughts allow for more effective and open communication. And last but not least, be honest. Acknowledge that we're living in an uncertain time and that they may have fears, and try to be as transparent about what's going on as possible. We know it's a changing climate, and sometimes we always don't know, but when we do know information, let's share it with our staff and show that we are on the same page and on the same team. So in closing, if you are new to social media, and you don't know where to start, I've included a handy little tool that gives you a lot of things that we're talking about in depth so that you can see how to send a tweet, what you should be doing, you're doing text messages, and how to effectively use your Facebook page. Thank you for coming by and have a wonderful day.